When we wear our masks or face coverings, you protect me and I protect you from the spread of COVID-19. But for the best protection against the coronavirus, we must wear and use our masks or cloth face coverings correctly. All persons over age 2 and who can remove their masks themselves should wear one. Before putting on your mask, clean your hands. Your nose and mouth should be covered with no gaps between the mask and your face. Do not touch the mask when wearing it. If you do, clean your hands immediately. Replace your mask when it's damp. Discard disposable masks immediately after use, or wash reusable masks frequently. When removing your mask, do not touch the front. Remove your mask from behind, discard, and immediately wash your hands. Let's protect each other from COVID-19 and wear our masks.
Good evening, Bermuda, and welcome to the members of the media who are gathered with us here today. I'm joined today by the Minister of Health, the Honorable Kim Wilson, who are providing an update on the latest from her ministry, in addition to additional measures which will be taken to curb any potential spread of the coronavirus outbreak. Following that, I will give an update on matters related to the measures that we must all continue to follow in order to keep our community safe, and I will also provide details of the pilot of the We Health app, which is now in the app stores. I will also detail some of the new features which will be launched by a complimentary app which was built by Bermudian students here for us. So first, we will go to the Minister of Health. Minister?
Thank you, Premier. Good evening, everyone. Today there were 808 test results received by the Ministry of Health, yesterday, the 23rd of November, and 4 were positive for COVID-19. One of the new cases is classified as imported with details as follows. One resident who arrived on Delta Flight 584 from Atlanta on the 22nd of November 2020 who tested positive on their arrival tests, having not had a pre-test. The additional 3 cases are classified as local transmission with known contact, with the details as follows. One being a resident having had close contact in the same household as a case under investigation linked to the workplace, and 2 residents having had close contact in the same household as a known case linked to the same workplace. Bermuda now has 239 total confirmed positive cases, and their status is as follows. There are 25 active cases who are all under public health monitoring. None are hospitalized or in critical care. A total of 205 have fully recovered, and the total deceased remains at 9. The average age of all of our confirmed positive cases is 53 years of age, and the age range of all of our positive cases is 0 to 101. The average age of all deceased cases is 74, and the age range is 57 to 91 years. Overall, 48% of the cases were black, 45% are white, and 7% are other or unknown. The source of all cases is as follows. 115 are imported, 100 are local transmission with known contacts or sources, 21 are local transmission with an unknown contact or source, and 3 are currently under investigation. The 7-time average of our real productive number is less than 1. Bermuda's current country status is now cluster of cases. With the recent uptick in local COVID-19 cases, there have been some questions raised about what constitutes a close contact. I will try and provide some clarity around that point. When a positive case of COVID-19 is identified in the community, the Ministry of Health began a process known as contact tracing to determine who that person may have been in contact with and may have infected. A person can either be a close contact or a casual contact. A close contact means spending more than 15 minutes of face-to-face contact with a person in any setting, living in the same household or shared accommodations as an infected person, or sitting within 2 seats of an infected person in any direction on an airplane. Casual contact means spending less minutes of face-to-face contact time within 6 feet of an infected person within any setting. Being in the same room as an infected person for less than 2 hours. Being on an airplane with an infected person but not sitting near them. Spending more than 2 hours in a close space, such as an office or classroom. An infected person can be either a close contact or a casual contact, depending on the circumstances. Whether it's classified as casual or close contact will depend on such factors as the room and other factors. Health officials will let you, not social media, the health officials. If you are a close contact of a case, you must symptoms of coronavirus, call your GP. You'll find out if you are a close contact because you would have been notified by the Ministry of Health's contact tracing team. If you are a casual contact, you should make sure you know the symptoms of coronavirus and be aware that you may develop them. You do not need. Persons who are a close contact should follow the guidance given to them individually by the epidemiology and surveillance unit. If you call the surveillance team and cannot get through immediately and are waiting for a callback, please be patient, as there are many contacts to be traced and persons with the closest contact will be contacted first. Also, if there is an outbreak in your place of work or business, remember that if you and your staff have been compliant as to what is required under our guidance, such as wearing a mask correctly at all times, washing your hands, and maintaining physical distancing where possible, your risk of infection from the outbreak will be significantly diminished. If you work in a smaller team in place where physical distancing is not possible or where staff travel together, you should also wear a mask. And these basic practices protect us every day and are in place for that reason, to protect us and to keep us safe. None of us can be complicit at this time. Without the precautions that we all know, wearing a mask, physical distancing, and hand washing, one case can easily multiply and spread. What contact tracing has taught us about the current increase in positive cases is that we are not staying within our small defined bubbles at all times. We need to work much harder to limit our interaction with families and friends. The ministry advises that you reduce your bubble sizes now. Choose only 1 or 2 other households to socialize with for the next few weeks. It is particularly easy to be casual in a workplace and relax around colleagues as you would around your family. Do not do this. As we enter the holiday seasons, typically a time when family and friends get together, we must be more mindful than ever about following these public health guidelines. Therefore, I would like to restate a reminder to travelers, which I've issued in a press release last week. All travelers, including returning students, are subject to mobile quarantine, restrictions on their movements and activities until they receive a negative 14-day COVID test. Therefore, all travelers should wear a mask at all times when in the company of others. Avoid indoor spaces, not attend large family gatherings. In particular, returning students should be careful of mixing with local students and family members while on island prior to their negative day 14 COVID test results. Similarly, those traveling for business should take the necessary precautions when returning and interacting with family and friends. The United States epidemiologists have observed that the way most people become infected in the U.S. may be shifting. In the summer, a large driver of the infections was young people socializing and bringing the virus home to their parents and relatives. Now, family and social gatherings are assuming a much more prominent role with respect to the transmission. If you will be hosting or attending a gathering during the holiday season that brings people who live in different households together, please listen to the following tips as recommended by the Center for Disease Control. Limit the number of attendees as much as possible to allow people from different households to remain at least 6 feet apart from all times. Guests should avoid direct contact, including handshakes and hugs with others not from their household. Host outdoor rather than indoor gatherings as much as possible. Avoid holding gatherings in crowded, poorly ventilated spaces with persons who are not from the same household. Increase ventilation by opening windows and doors. Require guests to wear masks. At gatherings that include persons of different households, everyone should always wear a mask that covers both their mouth and their nose, except for when eating and drinking. Encourage attendees to wash their hands often with soap and water for at least 20 seconds. If soap and water are not readily available, use a hand sanitizer that contains at least 60% alcohol. Limit contact with commonly touched surfaces or shared items such as serving utensils. Clean and disinfect commonly touched surfaces and any shared items between use when feasible. Plan ahead and ask guests to avoid contact with people outside of their household for 14 days before the gathering. Wear a mask while preparing food for or serving food to others who don't live in your household. Limit people going in and out of the areas where food is being prepared or handled, such as the kitchen or around the grill, as much as possible. And wash dishes in the dishwasher or with hot, soapy water immediately following the gathering. The more of these prevention measures that you put in place, the safer your gatherings will be. No one measure is enough to prevent the spread of COVID-19. Mindful of the changes in our status from sporadic cases to cluster of cases, additional public health restrictions will be put in place. First, as we must be cautious with our care homes due to the vulnerability of that population, the ministry is proposing to restrict care home visits. The primary change is a return to only essential visitors being allowed in the home. However, restricted outdoor visiting will be permitted. This will impact the availability of activities in the homes, including daycare. The ministry is currently consulting with the care homes on this matter, and a decision and order will be issued before the end of the week concerning this. Second, the ministry will seek changes to the Public Health COVID-19 Emergency Powers Number 3 Regulations 2020 to achieve the following. 1, a reduction in large group size from 75 to 50 persons. And 2, a more comprehensive mandatory mask mandate. For your cough, stay at home if you are sick, and avoid the 3 C's, closed spaces, crowded spaces, and close contact settings. Thank you.
Thank you very much, Minister of Health. And thank you for today's update and certainly yesterday's update. And thanks to the Chief Medical Officer who joined you at yesterday's press conference. Today, I will provide an overview of where we are in our ongoing fight against the coronavirus pandemic. It is my hope that Bermudians, residents, and tourists alike will hear the message and not only adjust their personal behavior, but also encourage others to do their part to ensure everyone's safety and well-being. As I have said numerous times, we have come a long way and we should be rightfully proud of what we have achieved. More so as we've gotten those results with Bermudians at the heart of the battle. Whether it's due to testing, technology, or correctly following protocols, we have been on the front lines and have been largely successful in keeping Bermudians safe. International institutions and travel bodies from across the globe have so far. I say so far because while our efforts have largely been effective, we are now faced with a new challenge. As the Minister of Health has now indicated, and the last few days have made clear, we have had a small outbreak of the novel coronavirus in Bermuda, with at least 2 known clusters. We are hopeful that we have it contained, but the fact is that we cannot do it alone, and containment requires everyone's assistance, every single resident of the country. Our behavior and the decisions we take now with this threat are much more important than when we initially responded to it. Our decisions are more important because we know the virus is here. Social gatherings are permitted, our schools are open, and we are all trying to recover economically. Our response to the virus is what enabled us to remain open. But I know that now we have gotten used to living with the coronavirus, and some people are not as diligent as they once were. Let me be clear. There are reasons why we have these important public health measures in place. And the reason for our collective success is that most of us have followed them and followed them well. So when you go out and people say, oh no, I don't have to wear a mask, no one in Bermuda has COVID, it is clear that that is no longer the case. The only reason that we were able to maintain that stance is because people were following the rules, wearing masks, sanitizing their hands, keeping their distance, and doing what was necessary. Let me give an example are so important. For example, an infected person arrives in Bermuda, has 2 negative tests, pre-tests before arrival and an arrival test, feels fine, and they may attend a small event at someone's house. They do not follow public health rules, and because it's not comfortable and they don't feel that they are putting people at risk, they don't wear a mask, and other people around them don't wear one either. They don't keep their distance. They may share utensils, share cups. This individual doesn't have any symptoms, but during a subsequent test, they are confirmed positive. In this example, a single person has potentially exposed everyone. Their family will be inconvenienced, or worse, they may be exposed and may be at risk. These are how vital that we take precautions. In the example above, if the person and persons around them were following the public health advice that we may grow tired of, but which is what has gotten us to this place of feeling tired, the risk would be far reduced. The laws of the country right now require social distancing, and if you cannot maintain your distance, they require you to wear a mask. That is the law. Now, there have been some who've asked whether or not we believe that there is a gap in what it is that we have rolled out and the regime that we've been following for the past 5 months. I am confident in the regime that we put in place, but it is vital that every single person in the country act as though if everyone we are in contact with may be infected, so that we can reduce the chance of spread. Again, we do not know who may be infected in a cluster. And I'll get to in a little bit of the work that we're going to do additional surveillance in the country. But what is vital is our personal and our interpersonal interactions must assume that people with whom we are interacting with may be infected, and we have to take the precautions in that way. If there was a wide outbreak, but if we all took those precautions, all of us, the chains of transmission will be broken. And that is what is most important, to break any chain of transmission. That's why masks, that's why physical distancing, that's why hand hygiene. And most importantly, that's why staying at home when you are sick is vital. Because we know that one of the outbreaks that took place was with some and went to work, infecting others. That causes an issue, and it is something that we have to guard against. We've come too far to allow the reckless decisions to impact the country. And so today, Cabinet has agreed to tighten some of the restrictions that are in place. Thankfully, we also know much more now than we may have known in March, and we have many more tools at our disposal which allow us to follow a more targeted approach. The Minister of Health has covered some minor changes, but I want to be clear to everyone that these are just initial changes that are being implemented. there is extensive testing and contact tracing that is currently taking place. And if we believe that there may be chains of transmission that we do not have a handle on, further and more severe action will be implemented immediately. Further, as there is an outbreak, risks at certain establishments have been assessed, and bars are thought to be the largest risk vector. Instructions have been issued to the Attorney General's chambers to finalize changes to the regulations to require employees at these establishments to be screened by a saliva test, so not a nasal pharyngeal swab, but saliva test for the coronavirus. The Minister of Health will announce the times for the saliva screening, but it is anticipated at this point in time that that screening will take place Wednesday and Thursday at 6 p.m. at the Perot Post Office. Let me be perfectly clear. I have no desire to close down establishments, but we must strike the right balance. In other countries where there have been minor outbreaks, immediate lockdowns were implemented. All bars, all restaurants, all gyms, all personal care services were immediately shut. We do not yet feel that is warranted, but we need the cooperation of workers and owners of establishments where there is the biggest risk of persons gathering indoors and possible vectors of spread to cooperate. We will continue to roll out additional screening as it is important that we have a grasp on what the outbreak looks like inside of Bermuda and to have a handle on it so that we can continue to be a success story rather than a casualty. And just as a note to bartenders, because you may get a saliva screening and because you test negative does not mean that you can go to the bar to work and work without a mask. We have asked the police to adopt a zero tolerance approach. And to be clear, last week a zero tolerance approach was not adopted. We have asked the police to adopt a zero tolerance approach. It is far too important for persons to let their guard down right now. I am confident that we can get through this very difficult period if we all remember the precautions of which have been put in place. But the zero tolerance approach, especially at licensed establishments, has been asked for by the government, and it is hopeful that that will be implemented. And with that, it means that if you are an establishment that is not following the rules which have been laid out, under law, the police can close an establishment for 24 hours to give you time to cure. Let's not let that happen. And we are going to make sure that we start with the highest risk establishments, but the Minister of Health and her team have already been to bars, I have no desire whatsoever to revert back to shelter, back to the place of where we were before. But if we do not all do our part, we will be forced to do so. And we have seen in other countries where small outbreaks have turned into larger outbreaks. That is not what we will have here. And I trust that the people of the country will cooperate so that we can constrain this outbreak. There are additional measures that will be announced in the coming weeks to assist in what we are doing in the community to make sure we keep a grasp of those risks. One of those will be the introduction of visual indicators so that persons can be aware of people who may have recently traveled and who may present a higher risk to the public. There will be possible further size and reductions in the amount of groups, and the Ministry of National Security will be far more judicious when it comes to approving large event permits. Specifically, events that will be taking place indoors will be examined far more carefully, and mostly outdoor events will be permitted. Finally, I want to reiterate the importance for all Bermudians to help to assist all of the enforcement teams. If you see an establishment that is breaking the rules and putting us all at risk, pick up the phone, call 211, and report it. No need to send me a WhatsApp. No need to send the Minister of Health a WhatsApp. No need to send the minister, no need to put a post on Facebook. None of that. Pick up the phone, call 211, and do your part to help us be safe. And to the owners of all establishments in this country, I reiterate again, now is the time to follow the rules. Do not find yourself caught. The simplest thing that can happen is your establishment may be shut down for 24 hours and to earn money. And none of us want that. Sure that we are all doing our part. As the cabinet mandated measures will get put in place, we will also use technology to help Bermuda manage the spread of the coronavirus. This week, we will finally, and I say finally because it's been long awaited, pilot the We Health Bermuda app. This is a new, free smartphone application that provides fully anonymous COVID-19 exposure notifications. It is one of the most sophisticated apps available anywhere in the world for helping to control the spread of the coronavirus. The app leverages groundbreaking technology from Apple and Google's jointly developed exposure notification system. When paired with manual contact tracing and combined with other preventative measures, such as wearing masks and physical distancing, We Health Bermuda gives us all even greater protection from the coronavirus. The government has partnered with We Health, an international public benefit corporation that created the We Health Bermuda app, to specifically customize this app for Bermuda. The Department of Health is in the final testing phases of We Health Bermuda. We do expect to find some minor fixes and improvements that may need to be made through early testing, but that is a normal part of any app launch. While we are in the final stages of testing the app, we welcome all Bermudians and all visitors to download it ahead of the full launch from Apple's App Store or Google Play. All you have to do is go to your store and search We Health Bermuda. The app will run on iPhone models 6S and above. This is kind of technical, with iOS version 13.7 or above installed, and Android users can use the app if their phone supports Bluetooth Low Energy and Android version 6 or above. And most phones nowadays have a little bit higher than that. They have Android 10. During this testing period, we welcome and feedback on their app experience. Once the app is downloaded and installed, it runs in the background, just like any other app on your smartphone. And I'm certain that you would have seen that when there are recent updates, there's this whole COVID notifications that shows up in the settings of all major smartphones. And it says that you have to install a compatible app. This is a compatible app. When phones that have We Health Bermuda installed are near each other, the app uses Bluetooth signals to determine how long and how close users were together. If a We Health Bermuda user tests positive for the coronavirus, they can privately share their diagnosis with the app. We Health Bermuda will then automatically send an anonymous COVID-19 exposure notification to anyone who is in close proximity long enough to be considered a risk of COVID-19 infection. Because the app logs Bluetooth signals and does not require contact information, We Health Bermuda can anonymously alert app users you do not personally know, which can help slow the spread. And this is important because when you download the app, it doesn't ask you for your name, you don't have to put in your email, all the rest. And it's important to note that none of this information goes to the government of Bermuda. It is an app that is built on a platform that was put in place to allow there to be completely anonymous exposure notifications, but to work to make sure that we can work to reduce the risk. Every We Health Bermuda exposure alert will provide app users with the date and time of the possible exposure, along with an estimated risk level and the next steps that you should take from the Ministry of Health. Members of the We Health team here in Bermuda met with the Privacy Commissioner, and he supports the approach and steps the government has taken to protect the privacy and the information of all those persons who have downloaded the app. And the reason why this took so long is because we wanted to make sure that all privacy considerations were put into place. We Health Bermuda notifications can help to alert others to potential exposure even before symptoms appear. Exposure notifications also allow people to quickly take the next steps to help prevent any possible spread. We Health has a track record of success at 2 American universities where the app has been downloaded by 50,000 people. They have built off of that success to customize this app for Bermuda and our needs. You can find out more information about We Health Bermuda at gov.bm/WeHealthPilot. Again, that's gov.bm/WeHealthPilot. That's all one word. Or, as I said, you can download the apps today. Just search We Health, one word, Bermuda, inside of your app store, and you can download the app now and start tracking your notifications. Using technology, together, we can make Bermuda safer. Additionally, there is another app that has been built by local Bermudians to assist members of the public who own establishments and are required to collect contact information of persons who enter their establishments for contact tracing purposes. Last year, the government of Bermuda launched a boot camp in combination with Code 441. 2 of the students from that boot camp this year were engaged to build an app. An app works by scanning the back of your driver's license. So right now, when you enter an establishment, you're required to write down your name and your phone number and your email for contact tracing purposes. What this app will allow is to skip that, for a driver's license to be scanned, for that information to not be kept with the restaurant itself, but to be able to be stored and accessed only if there has been an exposure and there is a need to contact trace afterwards. So what we've seen in some restaurants, of course, if you go to a door, there's a whole bunch of people's names and phone numbers, etc. And this is something that could be considered a privacy risk, as people can get persons' information. That is a crude method. We've now replaced it with an electronic method in where individuals will be able to scan their driver's licenses and will be able to record the contact details from that particular instance. That app was, as I said, developed and is ready to launch. It is not inside the app stores. It is a fully web-based app, so it can work on multiple items, and we'll be giving further details on that app as we roll it out over the next few days so that restaurants and bars, clubs, gyms, stores, anywhere they're required to keep contact information on the persons entering can simply scan that information in order, or you can elect, if you wish, to write your information down still. But this is a way to make it happen a little bit more quickly. In closing, as we consider the next steps and as we look at what needs to be done to ensure that we contain this small outbreak, I recognize that anxiety levels are increasing. People are concerned about what will happen next. People are concerned about their holidays. People are concerned about Christmas. People are concerned about their family. People are rightfully concerned. On the backdrop, certainly there is news overseas which will cause persons to naturally feel more anxious. This, combined with the backdrop of people being unemployed and financial stresses, are increasing for many. Depression, anxiety, feeling alone are just some of the emotions that people may be experiencing. I cannot stress it enough, and I will stress it every single time I do this press conference. Please understand that you do not have to suffer alone or in silence. There is help available. There are professionals who will listen and provide guidance to you at this time. The Emotional Wellbeing Hotline is a resource that you can use to talk with someone. The phone number is 543-1111. Again, 543-1111. And while we all work to make sure our physical health is taken care of, we must pay equal attention to our brain health. We must reach out and ask for help when we need it. Thus concludes my remarks for today, and I'm happy to take any questions that members of the public may have for myself and or the Minister of Health.
Good evening and happy belated birthday.
Thank you, Don.
Mr. Premier, you said last week a zero tolerance approach was not followed. Can you please give us a few more details on what happened?
I'm not going to get into specific details. As you would know, the government, the elected government of the country does not control the police. We've had discussions with Government House, and I'm confident that a zero tolerance approach will be taken in the future. I'm hopeful that a zero tolerance approach will be taken in the future. And when I say this, you saw that I think the police put out a statement and said that most places were in compliance. What we had asked for, if there was any place that was not in compliance, necessary, because my belief is that if the police come and if they tell someone to change something, if that person did not have that in place in the first place, when they are clearly aware of the requirements for operating their business and establishments during these times, if these rules have been set out and they have not changed, then they will just revert after the police leave. And it is important that we minimize these possible places of transmission. So there were conversations that were held with me, the Minister of National Security, also His Excellency the Governor. I'm confident that going forward we will be in this position, and I'm hopeful that the police will understand the government's desire for them to adopt a zero tolerance approach for licensed establishments who, under the law, they have the ability to close, who are not following the guidelines which have been clearly laid out. There is no excuse for bartenders not wearing a mask. There is no excuse for people to be crowded in a bar and not practicing physical distancing. There is no excuse. And for bars that are doing that, they have to recognize it's a risk. One person infected inside of a closed space can cause 30 people to be infected in 2 hours.
Wow.
One person, that's all it takes. And that's the reason why we are taking a zero tolerance approach. We have a minor outbreak. People are worried about the word outbreak. The definition is, it's an epidemiological definition. But intention of getting there. That's why we all have to be responsible. I'm not out to get anyone. But if we don't all do our part, we'll be challenged.
Okay, thank you. Health Minister, can you please explain more about the mandatory mask mandate? In what situations will it be required and how will it be policed?
Thank you, Don. The Cabinet, as the Premier indicated, had made some had further discussions today with respect to potential further powers to be utilized in our fight against COVID. And under the Public Health COVID-19 Emergency Powers Number 3 regs, there are requirements such as an obligation to maintain appropriate physical distancing. And we have instructed chambers to look into making amendments to the legislation to also require persons to wear a mask, certainly enclosed-in spaces and outdoors if they are unable to physically distance. But those instructions have been provided to chambers earlier today, and we await that confirmation that the regs can be amended accordingly to affect the policy decision of Cabinet.
Okay, thank you. You mentioned there were 3 close contacts today. What was the age range on those 3 people?
John, as we've talked about before, I don't think it's appropriate for us to identify and provide individual information about individuals because it possibly could reveal the identity of the individuals.
But like in the past, you've given the age range of people who've had.
Oh, the age range?
Yeah, the age range.
From 0 to 56.
For today.
Correct.
Thank you.
I'm sorry, I thought you meant to individualize it. But
No. Health Minister, last week you said visitors can't play contact sports. Test results. And then last night you said that workplace meetings should involve no more than 10 people. Is this a mandate or a suggestion?
The workplace meetings, that is part of our guidance. We are working on further information with respect to guidance concerning the mobile quarantine and what persons can and cannot do during the period of time when they're waiting their test. You'd appreciate that this whole COVID-19 phenomenon is a moving target. No 2 days are the same. What we knew 3 weeks ago has changed. So we have to be fluid and change with those circumstances, and those are considerations that we're having on a daily basis as it relates to what further precautionary measures and mitigations we need to put in place. But we are having those conversations, and more will be revealed in the newness of time. You would have heard me indicate either yesterday or today, and I can't remember, so forgive me, that we've just received our first day 14 results. So we now are seeing that previously the majority of persons were being testing positive on arrival. We now have a first day 14 test. So as circumstances change, we need to be conscious about those and make adjustments accordingly.
Okay. What's the difference between a workplace meeting and a gathering? Because the rules allow for a gathering of, well, you said tonight they're being reduced from 75. And where can we find this information written down for people to follow on the website?
There is quite a lot of guidance. The workplace guidance is on the website. So there's a specific guidance document entitled Workplace. With respect to the large group prohibition under Section 4, it relates to an assembly of not less than, and it will be 50 persons in any public or private place. But there are quite a lot of details concerning the workplace guidance on the website.
Okay.
And just one thing, Don, as the Minister of Finance has said, that was our first day 14 test, but I know what happens. Twitter blows up and everyone goes crazy saying someone was running around the country for 14 days spreading the virus. I just want to make sure we clarify that. That individual who was tested on their day 14 test who was positive was quarantined for a significant amount of time as they were traveling with someone who was previously confirmed, it was a close contact with someone who's previously confirmed as positive. So they were in quarantine. So they did test positive the day 14 test, but it's not that they were running around between day 7 and 14, as some people may believe.
Okay, thank you for that clarification. Health Minister, yesterday you made the plea for schools to make sure students were adhering to their classroom bubbles as well tonight, in other situations like the playground. Yet we see the minibuses packed with students with no social distancing, with children mixing from different classrooms, and they are seated next to each other in a closed space for periods of 15 minutes or more. Mm-hmm. Why is this allowed?
That is an extremely unfortunate circumstance. I'm glad that you've raised that with me so that I can certainly speak to the Minister of Transport concerning that. But the issue concerning the requirement of bubbles is paramount to us addressing this COVID. But I will have those conversations with the Minister. Thank you for raising that with me.
And when you say it's a minibus for schools, it's the exact same thing. It is that requirement, and those requirements have been clearly spelled out. So I thank you for raising that issue.
So just to be clear on that, the minibuses, if they seat 24 people, there should be one class and there should be seats in between the students?
I'm not going to speak to that specifically, but what I can speak to is that there are capacity restrictions and everyone is required to wear a mask.
Okay. And my last question, do we track and maintain contact with recovered patients to see how they are progressing over the long term? And if so, have there been any local cases of post-acute COVID syndrome?
I can't answer that. I'd have to ask the epidemiology team. I do know that they do keep in contact with individuals. However, once they're deemed recovered, then that contact no doubt fades away. But let me find out for sure if there's any post-acute recovery COVID persons that they're continuing to maintain contact with, and I'll get back to you.
All right. Thank you very much.
Fiona, what was that?
I knew you were right.
Thank you very much. Good evening. Fiona McWhirter from the Royal Gazette. Minister of Health, you mentioned that the age range of confirmed cases now starts at 0. Can you tell us if there's any more concern about an infant under the age of 1, whether or not they are more vulnerable than an older child or an adult, for example?
I think with respect to the vulnerability, obviously circumstances such as health play a part in it. Clearly a concern exists when we're speaking about such a young child. However, I think the more important factor that needs to be emphasized concerning that case, Fiona, is the fact that, again, we as adults have a responsibility also to ensure that we are adhering to the public health guidelines, and that, again, wearing the mask, washing our hands, maintaining physical distancing, and the like. It's a sad phenomenon, one that I'm not saying we were expecting it, but the reality is it is unfortunate. However, as I understand, the child is stable and is being, under his or her doctor's care. But again, the message to us as adults are to ensure that we take the necessary precautions that public health are advising.
Thank you very much.
The minister's being very kind. I'm going to be a little bit less kind. These things are preventable. There is absolutely no excuse. And the fact that we are dealing with someone who is under the age of 1, clearly, is due to the fact that at a workplace, people were not following simple and basic precautions. And there was an individual who had symptoms who was there for a week. Persons were concerned and nothing was done. Inexcusable. And so we're actually now dealing with potential additional restrictions in capturing the case and identifying the cluster as quickly as possible, because individuals had a concern and they took it upon themselves to go ahead and get tested. And someone else was looking to go somewhere, and then all of a sudden it was able to come together that quickly. But it was purely preventable. And so the message is to all persons, I'm not telling everyone to immediately revert to work from home. I'm not telling everyone to lock themselves inside. We have precautions which have been laid out that have worked for us, and we must continue to follow and enforce those. And don't be silly like people saying, oh, it's just the common cold. You don't know, but we have testing that is available. Go ahead and take advantage of it. And if you are not feel well, stay the hell home. And don't go coughing. It doesn't make sense. And I'm upset, Fiona, and I'm upset because this is completely and absolutely preventable, and it is inexcusable for this particular workplace for that to have happened. Completely inexcusable. If there's one place where they should have known what the rules are, it's that place.
Thank you very much. I don't know, obviously, which workplace you're talking about, but we have mentioned tonight, we've talked about bars, we've talked about salons and gyms, etc. In terms of offices, is there any way for maybe it's health teams or the police to monitor and enforce the guidance there? We're hearing about people coming in from abroad who are perhaps attending meetings without having had a day 4 test, which I guess would go against what you're talking about with regard to the mobile quarantine. What enforcement or monitoring can happen in those circumstances?
Well, the enforcement can be done from the management. They have a responsibility to ensure that their staff members have proper health and safety guidelines. And so the management themselves are required to ensure that the workplace guidance that's issued by public health is adhered to. So it effectively is the management. Now, if there's obviously persons that are employed and they feel that the management isn't necessarily following the guidelines or encouraging them to be followed, we strongly suggest that they call 211. It's anonymous. They can make a call and indicate that this is their observations with respect to their workplace. The biggest infractions that we are observing are with respect to the bars and the restaurants. So insofar as enforcement, that would be our desire, is with respect to increasing enforcement for those things, because those are hubs for potential transmission, because when people are consuming alcohol, they lose inhibitions, they become more friendly, close contact, et cetera, et cetera. So those are the areas of more concern as opposed to the workplace, and we would like more enforcement action surrounding those.
I don't want to give all these places a bad name, and I know that I heard from a few persons over the weekend who were upset with the level, I would say, of harassment that may have been coming from the police. And so we've encouraged them to make sure they are fair, as many establishments in the back of town as the front of town, and equal application across the board. But I also, at the same points in time that we note the places where there's the most risk, I also want to thank the responsible restaurateurs, the responsible barkeepers, the responsible gym owners, the responsible personal care service provider who, by and large, are doing the right thing. And so I just, not doing what they should be doing. A vast majority are. It's just that less now are doing it than there were before. And right now, with this outbreak, we need full and total compliance to make sure that we snuff out any reoccurrence of this virus inside of our community.
Thank you very much. Can you maybe also tell us a little bit about the difference perhaps between schools and workplaces? We've obviously seen that some classes have had to be, or some year groups even, have had to be quarantined, and that families have been affected by that as well. They've had to join that quarantine. It seems that that same thing doesn't happen in workplaces. Perhaps you can correct me if I'm wrong, but if not, can you maybe give us an idea as to why there's a difference there?
I wouldn't say that there's a difference. If there is a close contact, and we've just gone through an academic exercise describing the difference. If there's a close contact to a case, then that particular establishment, be it a school and or a workplace, depending on the circumstances, would be all asked to quarantine. So for example, I work on floor 3 and there's 10 of us on the floor. We all work in close proximity of one another, and one person is a case. The other 9 of us, because of our close proximity and if we're deemed as close contacts, would be required to quarantine. But if the office has 2 floors and there's another floor on the 4th floor, and it's been determined that the case has never been up on the 4th floor, they won't be required to quarantine. So it depends on the circumstances. Likewise, at school, if a child is positive, then the classroom would be required to quarantine. But it doesn't necessarily mean the whole school. In the cases that you've heard us speak about recently, regrettably, they weren't bubbling. The classes were not in bubbles. They were all engaging in after-school activities and so far as play and so forth. So it depends entirely on the circumstances. I think the lesson learned is the smaller the bubble, the less people that are affected if a case is identified.
Thank you. And maybe then this is my misunderstanding, but I was under the impression that certainly at least one of the schools there had not been any positive cases identified. So in that case, it's a classroom that has had to quarantine, although there weren't actually any positive cases in the school, unless that's since changed.
In some of the cases, the child was a close contact of a case.
Yeah.
Yes?
But not a positive within the school.
Correct.
There have been no positive cases identified at any school, public or private, this week.
Thank you. Excuse me. And some clarity, if you could, with regards to the pop-up testing sites. There seems to be some people that are talking about individuals attending there who have symptoms. Would that be the right thing to do, or people with symptoms shouldn't be going?
Thank you, Fiona, for that. If a person has symptoms, we are discouraging them from attending the pop-up. If they call the COVID hotline, they will be directed to the nursing team, who will make arrangements for them to privately get a test. Normally it's at the cathedral, but certainly symptomatic people should not be just showing up at the pop-ups. However, we are looking to, and hopefully we'll be able to finalize. In fact, we sent a letter to Corporation of Hamilton this evening to secure a location so that we can have a symptomatic pop-up location that will run every day. That's indoors, well covered.
That's great, thank you very much. And lastly, slightly unrelated, Mr. Premier, with regards to the situation at the docks, can you give us any movement there at all? I know it's Minister of Labour, but perhaps you're aware.
No problem. Cabinet works all the time. Minister of Labour reading email from right now that the dock dispute has been now referred to the for settlement for the Labor Disputes Tribunal, and the minister is about to gazette that there is a labor dispute that is currently in effect. This reference should get the dock workers back to work. I cannot state under what particular conditions. I do know that the Minister of Labor, through the Ministry of Labor and the Labor Relations Office, has been working with both parties to try to get to a resolution. I know the Minister of Labor worked all throughout the weekend trying to get one. There was another meeting yesterday, and there was an attempt to have some follow-up items today, but now the Minister has declared that there is an impasse, so he has issued a gazetted a notice that a labor dispute does exist. And I recognize certainly there are a number of challenges that result from this. But now that this has been done, I am hopeful that persons will return back to work so that we can continue trade and commerce and look to resolve this dispute which has come up.
Appreciate that. Thank you very much.
No problem, Fiona.
Trevor, TNN.
Good evening. Following up on that dock situation, as Fiona indicated, Premier, why hadn't you utilized the essential service legislation, taking an injunction on the dock workers and having them back to work?
That would be a question that would be directly better put to the Minister of Labor. So when the press statement comes out tonight, Trevor, you're happy to send a response and get that answer. I will say from where I sit, I have complete confidence in the Minister of Labor. The Minister of Labor worked through the process to try to bring the parties to resolution. And when he felt that there was a dispute, there was then the gazetting referral. The last thing I'm trying to do, I don't think that an injunction is the first step. I think that's probably something that's a little bit later down the stages. But the dispute has now been gazetted or will be gazetted. And so it is my hope that the workers will return back to work as we look to try to settle the impasse, and that has led to this labor dispute.
Thank you. And let's talk about, you made mention of bars and
No problem,
establishments. Word coming to TNN
word.
from one of my favorites that you like.
Stop
Chatman,
telling-
not a chat group.
Stop-
Word
stop-
coming
stop
to
telling everyone my
TNN
business,
from
Trevor.
Saturday, Premier. You were at the western end of the island
Yes.
at an establishment,
Mm-hmm.
and I saw documentation, a photo of you socializing. The persons that were around in these photos, and I'm in a wide range without masks. So the statement from these individuals that are watching us, saying Bermuda is watching. They're taking what you say to heart. A bit of advice for the Premier: can you practice what you preach?
Oh, I can absolutely practice what I preach, and I'm happy to say that, Trevor. What I can say is that all persons inside this staff, I was actually very impressed with how well Woody's was following the guidance. I thought that there may have been a little bit difference, but they had windows open. The place was properly well ventilated. Hand sanitizer, signing at the door. There was no person standing and congregating. Persons who were sitting at the bar and drinking, because you can't drink through a mask yet, were doing things. And the bartender was masked at all times. That was in the indoor space, where there were only about 15 persons there. In the outdoor space, the bartender was still wearing a mask. And persons who were seated, there were no people standing around. So I would say they did a very good job. And every time I got up to go anywhere, Trevor, I wore my mask, lest the Minister of Health come after me or someone send you a picture from TNN.
I just know that they're watching. Yes, sir.
Trevor, there's one thing that I know in this job, that people watch me all day, every
Yes,
day.
sir.
It's okay.
Yes,
I'm
sir.
used to it.
A question for the Health Minister. Minister, what are your plans on doing, what are you considering doing for the school kids that are frequent in the Washington Mall area in clusters, not wearing masks correctly, rather than just going home from school?
Insofar as that particular situation, because I've observed it myself, I would employ parents to exercise some level of responsibility over their children, to encourage them also to wear masks and to physically distance. These public health guidelines are for everyone. Children are not immune to COVID. And that the parents can also assist us with the messaging of reminding their children what their public health obligations are, particularly as it is a safety issue for the children. And what we would not like to see is a situation where there is a child that has transmitted the virus and then they take it home to parents or elderly grandparents who also live in the same household. So any children that are watching, that probably are not, but I would certainly hope that the parents will encourage their children to abide by the public health guidelines. Again, children are not immune.
Another question that came to me was that personnel at the airport are given different instructions to those visiting. So I'll give you a case in point. One individual that I know very well came in on a Monday, and I saw him in a location on a Tuesday. And my question was, are you back on island? And he said he just came back yesterday. So my statement to him was, oh, why are you out? Shouldn't you be quarantined? He said, members at the airport, individuals at the airport are telling him, so long as he wears his mask and he stays 6 feet social distance, he should be okay. What is the protocol?
Well, the protocol is, and I don't know in this particular case, was he wearing a white bracelet?
I didn't notice. I was just
okay,
concerned
because
that he was
presumably
mingling at a location that I'm
Sure.
not even going to identify where he shouldn't have been.
Okay, so presumably he had a pre-test. So if he had a pre-test, he would have had a arrival test. And every passenger that arrives in Bermuda is provided with documents, written documentation as to what the protocols are, checking your temperature, et cetera, et cetera, et cetera. And as I've spoken about before, and we are going to be providing further guidance on this, further communicational guidance on this, illustrations and the like. We have a phenomenon that's called mobile quarantine. And though I know the words don't seem consistent, when you have traveled from abroad and you have returned to Bermuda, your movements, as I spoke about today, are somewhat restricted. And until such time as you've received and I don't know the circumstances, but I'm going to presume that they did not have a pre-test. Until such time as they've received their final test at day 14, they are required to exercise extreme caution. Avoid large spaces, avoid crowded places, avoid huge family gatherings until they get their test results. That information, like I said, Trevor, is provided to them upon their arrival. I can't speak to who said what to them, but they would have received documentation in writing, and one would hope that it would be read. But the reality is, again, with respect to the mobile quarantine, until such time as you have been cleared with respect to all your test results, then you have to exercise extreme caution.
And it's important in that aspect, Trevor. And you would have heard the examples of which I would have given. The fact is that these individuals need to make sure that they are observing the public health guidance to the letter, because not observing the public health guidance to the letter puts the entire community at risk, and that's returning residents and or visitors. And so from that aspect, the Minister of Health has been very clear. You would have heard in my statement that we're considering further items which may assist, such as being done in other countries, such as visual indicators. So in other countries, people who have returned from travel have to wear special wristbands, not quarantine braces. I'm talking about special visual, bright wristbands that people can see that this person traveled until they get cleared from their test, so that persons can adopt the appropriate precautions, because I think that it's important. And so from that level, I mean, I was a little bit angry earlier from, of course, wearing the BHB shirt, but it's upsetting to me. But the challenge that we have is that.
Under the bus.
Pardon me?
Throw me under the bus, but go along.
That wasn't my intention, Trevor. You know that, Trevor. But what I am saying is that the challenges that we have there are certainly avoidable. And we all have to make sure that we are taking the precautions to make sure that we avoid these things.
Okay, well, I guess they screw us even. But
What
we'll leave it
happened now,
like that.
Trevor? What'd I do?
Another question, Premier. Some workers who were forced to leave the island are back on looking for their redundancy pays. These workers from South Princess. Was this covered in the agreement payout?
I'm sorry.
Some of the workers from Southampton Princess,
Okay.
guest workers that had to leave, some of them come back to receive their redundancies payout. Was this covered in the agreement payout? If not, why not?
I'm not certain of the question you're asking. Can you try that one more time?
Some workers, overseas workers,
Okay.
that were forced to leave the island prior to the redundancies payout from Southampton Princess are back on island looking for their pay. Were they included in the payout from last week?
The only answer that I can give to that question is that all persons who were due to receive under the laws and agreements that are their collective bargaining agreement, I think would apply for regular staff, and Employment Act, I think, would apply for management. were due to receive funds. I know that persons who may have left, I remember there was a conversation that those funds would find a way to make sure they're remitted, but every person who was legally obligated to receive something, then yes.
Okay. My last question: what is Christmas and Boxing Day going to look like this year, Premier? You know, we both like the gum bears. So what's going to happen with those, especially that love to follow the gum bears? What are the restrictions going to look like?
Well, gumbays wear masks. You might have to wear one too. I would say on a broader level, we don't know, Trevor. We don't know. I mean, and I know that's your
Any
last,
thought? I'm just saying, any
No, I'm saying,
thought?
no, that's your last question. That's your last question. So I'll take the time, to expound, because it really depends. And I think what I had said inside of my statement is clear that we now have to make sure that we are doing everything that is possible to reduce any possible additional local transmission of this virus, knock it back so that we can have a semi-normal Christmas holiday. If we get to a place that is worse, as I have said and indicated inside of my remarks, the government will not hesitate to take stronger and firmer action, which is necessary and required to keep the country safe. That's what's necessary. I don't want to do that. No one wants to take actions that will put at risk our nascent tourism recovery. No one wants to take actions that will put at risk the activity that is taking place inside of the economy, despite the fact that we have a pandemic that is raging globally around the world and has tried to rear its head here again. So I don't know what it will look like. We will determine what it will look like when we get closer to it. But I can say this, if we keep acting silly, it might be a challenge. And none of us want to go back to that place. I don't. I think that we can live our lives with good precautions, and I think that we can get us to a place where vaccines are widely available and persons will be vaccinated, and then persons will, have protection. I think that's fine. And remember, I'm getting the vaccine, Trevor. I don't know about you.
Say it again. Say it again.
Pardon me?
Say it again.
Persons will be vaccinated.
You get a vaccine.
I am. I told you I'm getting the
Good luck,
vaccine,
sir.
Trevor.
Good-
You asked me last week.
Good luck. Thank you, Premier.
No problem. But in saying that, it's important, and the only way that we're going to be at a good place is if we all follow the rules.
Evening, everyone.
Good evening, Ms. Palacio.
Maya Palacio for Media Maya. Just want to piggyback off of what Trevor had said about a person that you had mentioned that arrived and didn't know where they were supposed to be or where they couldn't have been because the form itself at the airport doesn't necessarily say. I can kind of confirm with that. I had the same situation with someone that I knew close to that. It didn't say it on the form, and people don't necessarily would check the website right away, even though they should. So just suggesting to the ministry, especially since a lot of students are going to be coming back, to have it on the paper, because I'm looking at it right now, to say like on day 8, you can't do this, that, and the other on day 9 tests. So that would be kind of helpful for those coming back home.
And you could assist me by spreading the word with your
I
Media
will do
Maya,
that. I will put it
especially if
on.
you have student population. Thank
on
you.
Instagram. First question here, and excuse me if you already answered it, but without the risk of identifying anybody, can you confirm whether or not any of the positive cases that you mentioned yesterday and tonight were teachers?
I cannot.
My second being,
I cannot because I'm unable to. I don't know. No.
but you don't know if any of them were teachers?
No.
Okay.
It may surprise you, but we really don't actually know who the positive cases are.
Okay. And because I mentioned, Prima, on the 22nd, you had tweeted like no school students, public or private, tested positive.
Oh, I know that no students had tested
Yeah.
public or private, and I had
But-
made the specific ask to find out. And so the minister and I don't get that specific information. The epidemiologists have that information, and then we can ask the questions, they can revert. But they jealously guard the privacy of individuals.
For obvious reasons, because it's public health information.
Thank
And
you.
certainly people, it's clearly obvious, yeah.
Yeah, thank you. My next question would be the restrictions that you had mentioned, specifically the one pertaining to 75 persons going down to 50. When would that restriction be put into place?
We instructed chambers tonight. It is a regulation, so as soon as they can complete the drafting.
Okay. And for persons who may have already had confirmed events for 75 people, what would their next steps be? Would that still be confirmed for them, or would they have to reconnect back with whoever?
I would they would probably have to go back to national security with respect to that, because once the law is once there's amendments to it, those are circumstances that they should speak to directly to national security about, as to whether or not they'll be imposing this or effectively grandfathering it in. But only national security could speak best to that.
What I can speak to, that all the large event applications which have been given all state that if public health conditions change, that those things are subject to revocation and adjustment, and that has been issued in all of the large event guidelines. And so what the advice, a few people had contacted me, and my advice is that now is not the time for large events. It's not, and we're going to be making sure that that is made clear, especially things, I know it's really difficult in the Bermuda winter to have things outdoors, but outdoor events are far less risk than indoor events. Indoor events right now will be, I'm certain that the Minister of National Security will take a far closer look and more scrutiny on those applications.
All right. Thank you.
Mike, can I just add something, please? Sure. Somebody actually just sent me a copy of the information that's presented at the airport. And I see what you're saying with respect to release from quarantine, but remember what I've been saying, it's called a mobile quarantine. So the reality is that you are under mobile quarantine, required to limit your movement, and that's principally for your safety and the safety of your loved ones. So as you would have heard me speak about in the press statement earlier about what mobile quarantine, avoid large group gatherings, avoid the 3 C's, etc.
Yeah. Yes. Thank you.
Thank you.
Well, just some people, just to go back, some people think that once they've had their second test, they can still move on, but can't, go to some big events, but still, let's say, to the restaurant and still sit inside.
Sure.
Some people still think
Sure.
that
like I
is
said, we
okay.
are working on a better communications plan of that, but I would really be grateful, recognizing the clientele that you have in your readership, that if you could help us to promote that message from your perspective concerning the importance of mobile quarantine, particularly for the students that are returning.
Yes.
Thank you.
My next question was about the website, actually, gov.bm. When I checked it before this press conference tonight, and you had mentioned that the pre-departure test was now going to be moved to 5 days instead of 7, and that still hasn't been updated on the
Because we haven't had the
website?
law yet. Those regulations.
Okay.
When we change the regulations, we have to do it lawfully. So we instruct chambers. When we made the announcement the other day, that was to give everybody a heads up that this law was coming. We instruct chambers and ask them to draft accordingly. So we're waiting for that. As soon as that's done, then it'll be a regulation and we'll table it.
Awesome. And for the 8 new positive test results that were yesterday, and then obviously the ones from tonight, that still hasn't been updated on the website either, though. The last day update for the COVID was November 19th. So
On the website?
yeah.
Okay.
So just a heads up to update that.
To the last day for update for what was?
I didn't
For the COVID-19 test result, all the regulars, it was November 19th was the last update. I checked it when I was sitting here before we started.
Okay, thank you.
Yeah, so it doesn't include the 8 from the weekend or the, yeah.
Well, thank you for that. It's bizarre. We're doing a pretty good job of getting that updated, so thank you.
You're welcome. And then my final question for tonight was about the expectancy of a vaccine. When will we be expected to see that on the island?
I was just emailing them about updating the website. We have secured, Bermuda has secured the facility through COVAX facility, as well as Public Health England have indicated that they too will be providing us with a vaccine. Whichever one is available first, that's what we will seek to obtain. It does seem like from recent reports from Public Health England that theirs should be available by the end of December, and we should have it on island soon thereafter.
Okay, and a follow-up would be, but will there be a group sort of meeting or forum about, what you have to do if you take it and any precautions and things like that so the island can know?
Well, there will be information out there, just like we do with respect to the flu and other types of vaccines, with respect to potential side effects and the like. I'd like to also just take this opportunity really quickly to reiterate the fact that we are finalizing the protocols, but it is likely that healthcare workers and the vulnerable will be the first recipients of the vaccine.
Okay, thank you very much. Those are my questions.
All done?
Yes.
Thank you very much. I thank everyone for tuning in. We leave you with a message that the Minister of Health and I had been saying for a very long time, that it is very important that we follow the rules very important that we follow the regulations, and we need everyone in Bermuda's support to ensure that we can get through this minor outbreak, cut off any possible change in transmission, and continue to be an example to the world on how to manage the novel coronavirus. There's a little bit of time to go before there may be some relief, but I sincerely hope that we can all work together as we have so well since this pandemic has begun. So with that, I would like to say thank you all, Bermuda, and good evening.